The most common human emotional challenge and diagnosis is generalized anxiety with depressive features. This episode is about anxiety, depression, or both. In other words, are you or someone you love feeling anxiety, feeling depression, or feeling both? In my world of mental health clinicians and everybody, we call this a differential diagnostic, which means we try to differentiate or decide between anxiety, depression, or both. And by the way, usually it's both. But most of the time, it's the leading edge is anxiety and depression follows. So just so you know that as we get this episode off the ground, knowing that really important part. When I talk about emotions, if you've seen my other episodes, I talk about primary emotions of joy, fear, anger, and sadness. Those are the biological responses to life that we all have: joy, fear, anger, and sadness. 4 emotional categories. And then we have feelings. Those are our subjective experiences, what we feel. So with joy, the joy response, the human joy response, we feel happy. We feel glad. We feel excited. We feel loving. Then there's the fear feelings, the anger feelings, and the sadness feelings. But in the mental health area of working with people, obviously we have these diagnostic categories of anxiety and depression and a whole bunch of others. But we're diagnosing whether someone is feeling anxious or feeling depressed or feeling both. And they correspond. Anxiety experiences correspond with the human fear response, and depression experiences correspond to the human sadness response. So it all fits within the framework, and I just keep it really simple for all of my patients, just really simple. Are you feeling anxious, feeling depressed, or both? Because there are all these different diagnostic labels and categories we have, and I'll just review them in a second, but what matters is, what are you just generally feeling or specifically or situationally feeling? That's what's really important to understand. Within the diagnostic labels or names in the DSM, Diagnostic Statistical Manual number 5, DSM-5, for anxiety disorders or anxiety feelings that are really difficult and challenging, we have, I'm just looking at my computer here, separation anxiety, social anxiety, generalized anxiety, a very important one, specific phobia, agoraphobia, panic, and PTSD. So separation is anxiety is typically from a really important person. You really feel fearful when you're not with them. Social anxiety is feeling anxiety in social situations, any type of social situation. I'm going to hold off on general anxiety for a second. The specific phobia is like, for me, I have fears of snakes and heights and going underwater. I love to be on the water, but going under, definitely a phobia that you can extinguish or get rid of with the right kind of exposure therapy or treatment. Just got to choose to do it. I haven't done that with water. Agoraphobia, or the fear of being out in big places, like grocery stores. Panic disorder, again, a very specific experience I need to discuss in a different episode. And then PTSD, post-traumatic stress disorder. A traumatic event like being attacked or a house fire. Those are like the car accident, those hugely traumatic, post-traumatic stress disorder. So some sort of trauma, and it's a huge fear response for survival purposes, and it stays with you. Flashbacks, dreams, stuff like that therapy can help you extinguish or get rid of over time. In the sadness category or depressive disorder, in the disorders in the DSM-5, we have just a few. Major depression, I'll talk about that in a second. Dysthymia is like a milder sort of permanent low spot in depression. And then disruptive mood dysregulation is designed for children and diagnosing children with this kind of difficulty. All right, so I'm going to move now to situational anxiety. So I make distinctions when I talk to people in my practice here, my patients, people who talk to me, between situational anxiety and generalized anxiety, just like I make the distinction between situational depression and generalized depression. So situational anxiety is this. It relates specifically or situationally to situations, places, or people. So like situationally, a job you have right now is awful, and you have situational anxiety like whenever you go to it. Otherwise, you don't feel anxious. Phobias are like that. Don't feel anxious otherwise, but certain things like going underwater, heights, things like that, cause you to feel really anxious or really fearful. This is a larger fear response, but only in certain situations, just only in certain situations. And again, PTSD is a classic one. Like you generally just don't feel anxious, but something happened, and so you have these huge fear experiences afterwards with dreams or flashbacks about the event, what happened to you. This also causes avoidance, like we just don't want to deal with snakes, so we don't want to go to that job. I mean, anything situationally that causes anxiety, we want to avoid. Again, we're hardwired to avoid that. Literally, avoidance is one of the two major biological imperatives. One is approach, that's great for me, and one is avoidance, don't go near it, get away. So we have avoidance with certain situational anxiety things. Now, I've talked about on this channel before about Big Amy and Small Hippo. This situational anxiety is not Big Amy, not an enlarged hyperactive amygdala. It's situations that cause you fear response or situational anxiety. That's what that is. So the next one is what I call generalized anxiety. This is Big Amy. This absolutely is Big Amy. That toxic stress or living in constant fear enlarges the amygdala. It's very active, hyperactive, and we have a bigger fear response, and we feel fear. We have the fear feeling almost all the time. It's generalized. It's not specific or situational. It's generalized. That's what this is. And so we also tend to feel shut down. We want to isolate. We feel paranoid, which is not a thought disorder or schizophrenic. It's just like, I don't like going out with people. I feel like really fearful, like they're watching me and all this kind of stuff when we have Big Amy or generalized anxiety disorder. And then lastly, like I said, we're just socially afraid. And it's all the time. It's not just a situation. It's like, just want to stay home. And by the way, it's remarkable, but over the decades, we've described people who are like fetal, like they go to their bedroom and they lock the door and they turn off the light and they get fetal in bed. We describe them as depressed, and they're not. They're afraid. Because one of the basic fear responses of us and other animals is that we just all curl up in a ball to make sure we don't, or try not to get hurt by the predator or whatever. The fetal response is a fear response. It's not depression, although depression can go with it as a sort of like included feeling, but fetal is a fear response. It's generalized anxiety, and it's really strong generalized anxiety, because when I talk about Big Amy, it's Big Amy, but it can be just simply bigger than average, bigger than typical. And so we can just feel that feeling almost all the time, but it doesn't have to be so huge. But when it gets really, really huge, people can't leave their house and they don't want to leave their bedroom. And so that's really, really isolated. And so there is treatment for that. There's absolutely, I help people this all the time, between what I describe to them and tell them, go see your doctor, your medical provider. The right medications are going to get rid of that. And the right therapy is going to help you understand it and really get rid of it all in the end. So the combination of therapy and understanding emotional responses, what's going on, and medication to shrink the amygdala work. They just work. They just work. And knowing how it all fits together is really helpful to people to understand that. Now, I want to talk about depression. And again, from how I describe it to people, there are two kinds. There's situational depression and there's generalized depression. So situational depression, and that's the most common type of depression, without question. Generalized is a lot less common. So the most common is basically, my life stinks and there's no hope it's going to get better. That makes all of us feel depressed, which is like a big, extreme sadness response that just feels like it hangs in there. It's most of the time, but it's not all the time. So generalized depression, it's all the time. Situational depression is you feel like that, but then you have a good day and you don't, or a good afternoon or good evening, or like every night is good. During the day, depressed, at night, feel fine. It's because of like what's going on for you, your perceptions of it, what's happening around you and to you and in you. It's situationally really sad or really not happy, lack of joy. And usually there's a hopelessness component as a part of it. So the hopeless is like, it's bad and it's never going to get better. So people like with a life is not good, but they're absolutely hopeful it's going to get better. We don't feel depressed in that situation. We're down, we're struggling, but we got total hope it's going to get better because X, Y, or Z is going to happen tomorrow, the next day, the next month, you know? So hope is huge in understanding our emotional responses to life. You feel really, really, really sad, really not happy. We call that depression. Lack of hope just feels really hard, really hard. That's one kind of depression, the most common type. The other type is what I call generalized depression. And by the way, the first one is not small hippo, as I describe it with my nicknames, but generalized depression is. It is small hippo. It's the atrophied hippocampus, and the science tells us all about that. And the science, just one article I love, it says, call it stress system blunting. So much toxic stress or constant fear causes big Amy, and after a while, it's like that sort of gets blunted and we have this just flatness, just vacant, just don't feel anything. Don't feel like fearful anymore, just like nothing. Don't feel joy at all. Don't feel anger at all. And don't even feel sadness. This is when the hippocampus, as far as I can tell from what I read in science and I see in my patients once in a while, because it's more rare, but it's like everything is shut down. And I think evolution shaped it that way to survive so much fear going on that the brain just shuts everything down to just go forward and work together with your community to get things better. But anyway, this feeling is like, this is the kind of feeling where, you know, therapists and people say, look, make these changes and you'll feel fine. And the person's like, no, nothing's going to change this. So this is when I say, again, talk to your doctor, a medical provider, ask him or her about a serotonin medication. Just like you would for Big Amy or an enlarged amygdala, the science tells us, and my experience of talking to people here tells us that serotonin medication helps this as well. It grows the hippocampus. It literally grows it. It takes a couple of months. Just like shrinking the amygdala, it takes a couple of months, but serotonin grows the hippocampus. And people feel like, I feel alive again. It's exactly what they say. I feel alive again. I feel everything again. I feel joy. I feel sadness. I feel normal feelings again. You could wait it out with lots of love and lots of change, but I don't recommend it. I recommend talking to your medical provider. And if he or she agrees to try serotonin medication, like Lexapro, my favorite, just as a therapist, Zoloft, things like that. So that's generalized depression and how to treat it. Finally, the most common human emotional challenge and diagnosis is generalized anxiety with depressive features. That's the most common thing I see. That's the most common thing I see from the research too. So what happens there is like so much toxic stress or living in constant fear grows the amygdala. And science shows that clearly. Grows the amygdala because the amygdala is this really, it's a big, big player in the emotional response system. It's like all life gets filtered through the amygdala. Maybe that's what I've seen so far, and then everything else. But it's a big player. Anyway, with constant fear or toxic stress, it grows. And then we have this larger amygdala means larger fear response, like all the time. So instead of feeling just concerned, you're nervous. Instead of feeling nervous, you're afraid. And so, anyway, having an enlarged amygdala, or what I call Big Amy, and is generalized anxiety, just like anxious almost all the time. It's not situational, it's just like almost all the time. And that gets depressing. So the key about that is like, it's awful. You don't want to live like that. It's really, really uncomfortable, if not incredibly uncomfortable, and that gets depressing. So that's why generalized anxiety with depressive features is the most common emotional challenge for us human beings. And like I always say in this channel, if all of that happens, believe it or not, there's nothing wrong with you. Your brain, your body, yourself, you're actually responding the way you're supposed to. It's just that it's really uncomfortable. We don't want to live that way, so we seek treatment. Whether with me as a therapist, or a doctor, a medical professional, or I recommend both. With generalized anxiety or generalized depression, I recommend both treatment of psychotherapy, change, and medication. But with situational anxiety or situational depression, that's up to you whether or not you want to seek medication along with therapy and change. I don't think it's as vital, but I'm not a doctor. The doctors and nurses and physicians' assistants, they'll decide that with you. But I don't see from the science that your brain has changed in the amygdala or hippocampus, so I don't think the serotonin medication is that vital for situational stuff. But for generalized stuff, yes, I do. I recommend you talk to a medical professional. So I hope this has been helpful, because you deserve it and you are awesome.